Welcome to PALS. It's Professor Emu's Anatomy Lecture Series. In this place, our goal is to make anatomy simple. If you're just joining us or you have not subscribed, we would like you to subscribe now and be part of this amazing anatomy family. In today's lecture, we'll be discussing the anatomy of the brachial plexus. This lecture is divided into 3 parts. Part 1, which you're watching now, will focus on the components, the location, formation, relation, and distribution of the supraclavicular branches of brachial plexus. In part 2, we'll be looking at the distribution of the infraclavicular branches of brachial plexus. And in part 3, we'll look at brachial plexus injuries and their clinical presentations. So no time to waste, let's go to class. The brachial plexus is actually a very important topic in anatomy, particularly in the upper limbs, because it is here that the nervous network that supplies the upper limb is formed, and also that supplies the pectoral girdle. The terminal branches from this brachial plexus will supply different parts of the upper limb, and injuries to all or part of its nerves will affect in varying degrees, and also depending on the branch affected, movement of the various parts of the upper limb. Now, it is so important that there are so many clinical correlates associated with this brachial plexus. Well, in your clinical practice, I'm sure you're going to have encounters with some of the cases I'm presenting here. In this case 1, by the end of our lecture, you'll be able to explain why this baby here, this baby is having the neck tilted so far away from the shoulder in what is apparently a vaginal delivery that is actually very difficult. This baby will most likely be unable to raise the arm or laterally rotate it. You will be able to explain why this baby's arm on the affected side may most likely hang this way. Look at this picture. Yes, this baby's hand may likely hang this way. Also, you will connect why a man that had this kind of bad fall, look at this, may likely share the same fate with this baby. And this is what the picture will look like. Let's look at another case. We'll be able to explain why a man that broke his fall by hanging on a tree like this, or this baby here that is having the arm stretched this way, may most likely end up unable to extend the joints of the fingers and also unable to flex the metacarpophalangeal joint, and may end up with a disability like this. I will also show you another case that will interest you. By the end of my class too, you will also be able to understand why this man here, after prolonged use of these crutches, may have difficulty or may even be unable to raise the arm in abduction. Not only that, may lose part of the muscles here. The deltoid is lost. And also sensations around here would also be lost. So get set, let's take a look at this brachial plexus and be able to understand a lot more clinical cases associated with brachial plexus. So in this lecture, I will explain to you the meaning of plexus and also brachial plexus. We'll look at the various parts of this brachial plexus and we'll determine how it is formed, the cause of the various parts and the structures lying around them, that's the relation. We'll also look at the branches and the muscles these branches supply. Of course, we will consider the clinical correlates. So what is a nerve plexus? It's very simple. It's a system or network of connected nerve fibers that link spinal nerves with specific areas of the body. So in our case, what is brachial plexus? It is a network of spinal nerves that will supply different parts of the upper limb and pectoral girdle. This is a section of the brachial plexus. Now we see 2 levels of innervation. One is cutaneous, which is also called sensory. The other is muscular, which is also called motor. Now, where do we find this brachial plexus? Some people just think it's in the axilla alone. No, brachial plexus actually starts from the neck. We can see the brachial plexus starting from here within this neck region. It will run below the clavicle, run through the outer border of first rib, and then we find all of them in the axilla. Now at the axilla, they don't stop there. There they will give out their branches, and these branches will extend into the arm, into the forearm, and then the hand. Now this is not the only place we also see branches. We also see some branches at this upper part. So we are talking about two levels of branches, some above the clavicle, and then some will be below the clavicle. So let's go right on and find the different parts. So we have 1, 2, 3, 4, 5 parts of brachial plexus. What are these parts? The root, trunks, divisions, cords, and branches. So if you're a fan of using mnemonics, I have one here for you. Read that damn cadaver book. Let's take a look at our picture. Here, we're seeing the white part here are the parts we'll call the root. And the yellow part here will be the trunk. The red part will be the divisions. The green part, the cords. And then all the blue parts will give us the branches. Where are these parts located? Now we see the root and the trunk in the posterior triangle of the neck. Both of them are there. We can see here, this is the area of the posterior triangle of the neck. But there's a difference where we find them. The root will be seen between two muscles that are found along the region of the neck. These two muscles are the scalene muscles. So the root will be found between the anterior and the middle scalene muscles. Now, while the trunk will be found at the lower part of the posterior triangle of the neck. Now, for the part we call the divisions, the division is this part that is seen under the clavicle. So the divisions are found below or deep to the clavicle. What about the cords? The cords will be found in the axilla. That's the armpit. For the branches, we have branches that are seen below the clavicle. So those branches are the branches we will call the infraclavicular branches. For the branches that will be coming above the clavicle, we will be calling them the supraclavicular branches. We'll now start looking at how this brachial plexus is formed. We'll also consider the cause and then the relations. First, we'll take a summary. So we'll look at the roots. Here are the roots. Now the roots here are C5 down to T1. So these roots will continue as the ventral rami of spinal nerves. So these are spinal nerves C5 to T1. In the next slide, I will give you details of how they came to be. But for now, let's call them the continuations of the ventral rami of spinal nerves C5 to T1. Now the roots will fuse together to form the trunks. The trunks will split to form the divisions. The divisions will now merge again here to form the cords. And from the cords, we'll have the branches. So the cords will give off the infraclavicular branches, while the roots and the trunks will give off the supraclavicular branches. We'll now take them in details. Now we start with the roots. The roots will arise as spinal nerves. These are spinal nerves from C5 to T1. Here, this picture shows a segment of the spinal cord, and we're seeing the roots emerging here. Now, when these roots emerge from the intervertebral foramina of the vertebral column, they will do two things. They will first of all give innervations to two sets of muscles. The first set will be the muscles we call the prevertebral muscles, and the second set will be the scalene muscles. So after the spinal nerve gives innervation to these muscles, they will now do the second thing, which will be they will divide into two. Now this division will be into the anterior branch and posterior branch, what we call the ventral ramus and the dorsal ramus. So after dividing into the dorsal and ventral ramus, the ventral ramus will be the ones that will continue as the root of the brachial plexus. Now, this other picture will also give us more information. Here are the spinal nerves. At this point, we are seeing the two rami. One is anterior, then that is the posterior. The anterior will continue and will now form the root of the brachial plexus. So in this slide, we'll be looking at the formation and we'll also look at the relation. For the formation, we already know they are from the spinal nerves C5 to T1. Which of the rami? The anterior rami. Now for the relation, we've already said that the roots are seen in between two muscles, and then there's a space there, and we call this space the interscalene space. This picture here gives us a good illustration. Here is the anterior scalene, and that's the middle scalene, and in between is the interscalene space, and we can see the roots emerging from this space. In this formation, we've already noted that the roots that we're interested in are C5 to T1, but sometimes the origin of the plexus may shift by one segment. It may go up or it may come down. When we have a segment up, in this case, like in this picture, this is the normal distribution of roots, that is C5 to T1. Now, in such variation where we have a segment up, that means at this point we'll be talking about C4. If C4 joins in the formation of brachial plexus, we will now call that brachial plexus prefixed brachial plexus, because we are having a segment before the normal distribution. That's prefixed. When this happens, now the T1 contribution will not be there, or even if it is there, it is going to be very minimal. So this case is the case of prefixed brachial plexus. Now for postfixed brachial plexus, we are looking at a contribution from T2. When T2 joins in the formation of brachial plexus, we are now going to see that the C5 will not be there. Even if it's there, it's going to be minimal. So in prefixed brachial plexus, we are talking about C4 to C8. While in postfixed brachial plexus, we are talking about C6 to T2. We'll look at the trunk. The 5 roots, as we've already noted, will be seen between the interscalene space. These roots will merge in specific forms to form the trunks. So how are the trunks formed? Let's look at our picture again. Here we're seeing the first 2 roots, C5 and C6. They will come together and fuse and form what we call the superior trunk. Now let's jump down to the last 2. Here we're seeing the C8 and T1. They also will fuse, come together to form the inferior trunk. That leaves only the C7 to itself. So C7 will continue as the middle trunk. So we have 3 trunks, the superior, the middle, and the inferior. What is the relation or location of this trunk? The trunks are found at the lower part of the posterior triangle of the neck. The picture here is actually a live dissection of cadaveric specimen. And here we can also pick the roots, and we can see how they are forming here. This is the last 2 roots, the C8 and T1 forming the lower trunk. This is the middle trunk, which is C7 continuing, and then we have the C5, and then we're having the C6 here, C5 and C6 continuing, fusing together to form the upper trunk. We'll look at how the trunks will give rise to the division. The trunks will run from the floor of the lower part of the posterior triangle of the neck and will run deep to the clavicle. Now in this live dissection, here is the clavicle. Already we can pick out the trunks here. This is the inferior trunk, here is the middle trunk, and that's the superior trunk. Already from the separations we're having, we're seeing the 2 divisions, the anterior and posterior, anterior and posterior, and anterior and posterior for each of the trunks. So these trunks will split into two under the clavicle here. We have 6 divisions. Now, what is the relation or the location of the divisions? The divisions are seen deep to the clavicle, or they lie behind the clavicle. How do the divisions form the cords? We've already noted where we find the divisions, deep to the clavicle. Now from this point, this picture shows us this is the clavicle, and then we expect the divisions to be here. So these 6 divisions will move forward, and in the outer border of the face strip, as we can note here, they will now fuse to form the cords. So how are they formed? Now here we'll be seeing, let's look at this picture. We'll be seeing for each trunk we are seeing 2 divisions, the anterior on the green part and the posterior on the blue part. So we'll see how the lateral cord is formed. They will form 3 cords. One will be called lateral cord, the other medial cord, and the other the posterior cord. Let's start with how the lateral cord is formed. Now, the 2 anterior divisions of the upper trunks, that is, this is for the superior trunk, this is the anterior division here, and this is the middle trunk, this is also the anterior division. Both will fuse to form the lateral cord. Now, it is remaining only one anterior division, and that is the anterior division from the inferior trunk. This anterior division will continue on its own and will form the medial cord. Now, the posterior cord is formed by fusion of all the posterior divisions. As you can see here, this is the posterior division from the superior trunk. This is that for the middle trunk, and this is that for the inferior trunk. They all fuse together and continue as the posterior cord. So here are our 3 cords, the lateral cord here, the posterior cord, and the medial cord. The relation of the cords are actually very important. The cords will run from the outer border of the face rib and will run into the axilla. A sheath called the axillary sheath will wrap round the cords and the vascular structure, and then will run from the cervical region into the axillary region. These cords have a very strong relationship with axillary artery. Now, this relationship changed at the various parts of the axillary artery. The axillary artery has 3 parts, the first part, the second part, and the third part. Now, let us see how the cords of brachial plexus related with these 3 parts of the axillary artery. First, the first part of axillary artery. Now, in this first part, we'll be seeing the lateral cord and posterior cord lying superolateral, while the medial cord will be lying posteriorly. Now, in the second part, let's look at this diagram. The relationship will change. Now, these cords will relate to the axillary artery based on their names. By that, the lateral cord will lie lateral to the axillary artery. Here is the axillary artery, and these are the cords. So the lateral cord will lie lateral, medial cord will lie medial, and then the posterior cord will lie posterior. Also, in the top part of axillary artery, the branches from each of the cords will also maintain this arrangement. By that, all the branches from the lateral cord, as you can notice here, will lie lateral, and those from the posterior cord will lie posterior, and those from the medial cord will lie medial. The same can also be seen in this illustration. We will next consider the branches. Earlier in this lecture, we've mentioned the 2 branches, the branches from the trunk and the roots, called the supraclavicular branches, and the branches from the cords, called the infraclavicular branches. Now, we have 4 supraclavicular branches, and these branches are the dorsal-scapular nerve, nerve to subclavius, long thoracic nerve, and suprascapular nerve. Now, let's look at this picture to identify all of them. Here we are seeing the dorsal scapular nerve, and here we are seeing the long thoracic nerve that's picking origins from C5, C6, and C7. That's the nerve here. That's the long thoracic nerve. Now here, between the C5 and C6 roots, we are seeing the nerve to subclavius. And finally here, we are seeing the suprascapular nerve. Now for the infraclavicular branches, we'll be having 13 of them. 3 branches from the lateral cord and 5 branches each from the posterior and medial cords. We're going to start our discussion on the supraclavicular branches by considering the long thoracic nerve. We will look at the distribution. Now, as we noted, it has roots from C5, C6, and C7, as you can also see in this illustration. Here is the long thoracic nerve running down, and these are the contributions from C5, C6, and C7. Now, this nerve will run distally and will run deep to the, in this picture, we can still see the nerve running here, running deep to the clavicle and running on the lateral aspect of the thoracic cavity to supply serratus anterior. When there's injury to this thoracic nerve leading to atrophy of serratus anterior, this vertebral border of the scapula will be raised up, giving an appearance of a wing on the patient, as if the patient is developing a wing. And this condition is called winging of scapula. The next branch we'll look at is nerve to subclavius. Here again is the nerve to subclavius. And we can see it has 2 roots, one from C5 and the other from C6. Now this nerve will descend in front of the brachial plexus and will run to supply the muscle called subclavius. Here in this diagram is the subclavius muscle. So this is the muscle that's innervated by this nerve to subclavius. The next nerve to consider is the suprascapular nerve. The suprascapular nerve, like the nerve to subclavius, also has root values C5, C6. Here is the suprascapular nerve. Now, this nerve will enter the superior border of the scapula, as you can see in this illustration. Now, it's entering the superior border of the scapula. By doing so, it will pass through the notch in the superior border of the scapula called the Suprascapular Notch. With the ligament across it, it will now run through the foramen that is formed, which is called the suprascapular foramen. It enters the supraspinous fossa and gives a branch that will supply the muscle that is found here, which is the supraspinatus. This nerve will also pass through the second notch, and that is the notch between the spine and the glenoid fossa. And the name of this spine is called the spinoglenoid notch. Here is the notch. So it will pass through this notch to enter the infraspinous fossa. And here is a branch that will enter the infraspinous fossa to supply the infraspinatus. Here in this diagram, we can see the 2 muscles mentioned so far, the supraspinatus here and the infraspinatus. Also in this same diagram, we can see the branches. Here is the suprascapular nerve entering through the suprascapular notch, and this is the branch to supraspinatus here, and then here is the branch to the infraspinatus here. This is where we'll end the first part of this lecture. If you have questions, comments, or suggestions, please drop them in the comments section. Part 2 of this lecture is on the distribution of the remaining branches, and these are the infraclavicular branches of the brachial plexus. We will not stop there. We also have part 3, which is on brachial plexus injuries and their clinical presentations. Make sure you don't miss that. And if you consider this material helpful, we will encourage you to subscribe, like our video, share it to your friends that you are sure it will be helpful too. And together, we will build a unique anatomy family where we'll make anatomy simple. Make sure I see you in my next video. Bye for now.